If you have hives, here are 5 ways to treat it. The first thing you want to try is getting an ice pack like this, or maybe a bag of frozen vegetables or frozen fruit from your freezer, and then wrapping it in a towel or a pillowcase or a sock, something that prevents the ice from being directly in contact with the skin. That can help prevent an ice burn. So then once you've got this, you just apply it directly to the skin for a few minutes, and this should help to reduce the redness and swelling and also reduce the itchiness as well. The other thing you could try is using a cream. So there are 2 types of creams you could choose. So one is an antihistamine cream, which contains mepyramine malate, and this is for people who are over 2 years old. You can apply this up to 3 times a day and usually for about 3 days, but hopefully the hives has resolved by that time. The other cream is a hydrocortisone cream or an ointment, and you can apply this twice a day. It's for people who are over 10 years old, and this is for a maximum of 7 days. Again, hopefully the hives has resolved by then. So you can apply these at the same time, but I would recommend just using one to see if it works, and then if it's not working, try the other one. And also, depending on the age, you may not be able to use both. The other kind of cream you could try is a cooling cream that contains menthol, but that's just going to work like the ice pack, where it helps to reduce the swelling, redness, and the itchy sensation. The other thing that you could try is taking an antihistamine tablet. And so this will help to reduce the itchiness because it reduces the production of histamine, which is a chemical that your body produces when it's having an allergic reaction or it's just reacting to something. So when you take an antihistamine, it might make you feel sleepy. So just be aware of that. And the other thing is that you should not drink alcohol if you are taking an antihistamine because it might make you feel even more sleepy. And so make sure you drink plenty of water if you're taking antihistamine because it could cause some level of dehydration, especially on a hot summer's day or if you are in a place where there's lots of heating. So if you cannot take an antihistamine tablet, then there is a liquid version available that you could take instead, especially if you need to give a treatment to a child who cannot swallow tablets. And following on from that, you could try taking something to help to reduce the swelling and maybe to reduce any kind of pain. So you could take ibuprofen, and this will help to reduce the swelling, reduce the redness, and get rid of any pain. And then also there is paracetamol, which helps to reduce pain, but it will not get rid of any redness or swelling. So you have 2 kind of options for painkillers, and you should have seen a pharmacist or doctor to check which one you are allowed to take. They are also available as liquids if you need to give them to a child. If you have hives and the hives just starts to get worse and you start to feel like you can't breathe or there's any tightness in the chest, or you start to get really swollen lips and a really swollen throat, or if you start to feel really dizzy, then these are all signs where you need to seek immediate emergency medical attention. So call the emergency services, whatever that number might be. In the UK, that number is 999. And so make sure that you get urgent medical attention because hives could be the first signs of a serious allergic reaction. And if you do know that you have been in contact with something that is giving you that allergic reaction causing those hives and you are severely allergic to it, then make sure that you have an adrenaline injection available with you or from someone who has a first aid kit that has an adrenaline injection or also known as an epinephrine injection. Then make sure that you have access to that and use that immediately and call emergency services to get the medical attention you need. I hope you found this video helpful. Thank you so much for watching, and I'll see you in the next one.